My name is Dr. Jeff Bill, and I'm the founder and CEO of Sunrise Treatment Center. After I finished my family medicine residency in the summer of 2006, I returned to my hometown on the west side of Cincinnati to begin private practice. At that practice, there was another physician who was already certified to prescribe Suboxone to treat people for problems with pain pill and heroin. Since she was leaving the practice, she asked if I would go ahead and do the training so I could continue their care. For the next year, I tried to provide those services out of that family practice. But all along, I thought that if I could find a space to really focus just on the addiction care alone, that it would work out much better for the patients that I was trying to serve. And with that, a year later in October of 2007, Sunrise was born. In the years after I founded Sunrise, I sought out more and more experiences working with other organizations to provide medication-assisted treatment. What I noticed was that the offices were mainly focused on the clinical services and didn't have as much involvement from the medical side. From my perspective, since we were using medication to help people with their substance use disorder, I thought that it should be an office that looks and feels and runs like any other office where any other chronic disease process is being managed.
I think it's really important that a patient gets a full medical evaluation when they first walk in the door. We all know that everyone is presenting with a substance use disorder of sort, but really we need to know who they are as a person, where they're coming from, what other medications they take, the social history, where they're living, who they live with, things about their family. It's just very good to know any kind of medical conditions they might have, which could affect their care. In particular, hepatitis C, that's something we see very often, that's something we treat at Sunrise. A lot of times patients will come here and they've been told over the years that they have hepatitis C, but no one's ever offered to treat it. Or they will have been referred to a GI doctor or infectious disease doctor, and it takes so long to get in, they oftentimes don't even go. So that's one important medical condition that we screen for with every patient that walks in the door. That's another reason why it's very important to get a full medical evaluation.
Counseling addresses parts that the medication can't. The medication does a fantastic job of controlling cravings and helping avoid withdrawal and many of the biological factors. The counseling more addresses the psychological factors, the emotional factors, and the lifestyle that sometimes comes with being in an addictive process, and helps a person to evaluate those things that trigger cravings, those lifestyle choices, and helps them change into a more healthy, non-addicted lifestyle. The truth is, nobody selected or chose to become addicted. Nobody desired to come up with a substance use disorder. It's something that happens. Nobody decides to become a diabetic. And the person in front of you is somebody who is seeking help and wanting to get their life back on track. And without dignity and respect, there's no trust, and the ability to develop hope and a collaborative working relationship with them doesn't exist. You have to treat them with dignity and respect because they are a person.
The core values at Sunrise were rewritten in 2018 by a group of employees. We identified 12 individuals across our organization to work with our corporate and executive staff at determining what's important, what they see going on a daily basis, and what embodies us as an organization. So they came up with some amazing values that are really meaningful. Probably the most prominent one is treating others with dignity and respect. That goes to both staff as well as patients. And we adhere to that on a daily basis. Other excellent values that they came up with have to do with innovation and creativity and forgiving mistakes. We talk a lot about loving and compassion and using those in our everyday decision making. There's no job that's too big or too small. We want to be the best at what we do. and adhere to the highest ethical standards. So some of those are the core values that are critical to our day-to-day functioning. When patients arrive at our locations, they can expect a very clean and professional environment. Coming into the doors, into the waiting room, the furniture is well kept, it is organized, it's not in disarray. We have color palettes that match all of our locations. The artwork we put on the walls is very nice. Many of our locations have inspirational artwork, and other ones just have very nice scenes in them. We're proud of the work that we do, so we have our certificates all framed and our licenses and certifications clearly displayed for our patients. So from just start to finish, it's a very professional, clean, well-run experience for the patient. Our Columbus office is located on Highview Boulevard near Columbus Metro Library. This site services residents of Obitz, Marion Village, Grove City, Columbus, and the surrounding areas. Our Springfield office is located on Parker Court behind Goo Goo Car Wash and O'Reilly Auto Parts. This site services residents of Springfield, Enon, Yellow Springs, and the surrounding areas.